my pleasure to introduce the next session, Building Health and Equity for All, What's Not to Love. And the moderator for this session will be Danielle Gibson. Danielle Gibson is a passionate community leader and advocate for social justice. He has spent the past 10 years championing jail and prison reform, affordable housing, access to medical care for the chronically homeless, HIV/AIDS prevention, and LGBT rights. As Allegheny Franciscan Ministries Regional Vice President for Miami-Dade County, Danielle oversees a place-based giving initiative in Overtown, a historically African-American neighborhood in Miami that has been besieged by social and civic inequities for half a century. Danielle?
Thanks a lot. Hey. Good afternoon. Good afternoon. So we are the last panel workshop before you guys get your networking. So we understand that, and we're going to get through this. So my name is Daniel Gibson. As it was explained, I'm from Allegheny Franciscan Ministries, which is a health foundation. We have a presence here in Palm Beach County. I'm actually regional vice president down in the Miami-Dade area, and we're also up in the Tampa Bay area. And I just want to sort of thank Andrea Iglesias and Valerie Nielsen, who helped organize this. And really, I want to thank them for actually having the foresight or the bravery to actually ask me to moderate, because all day today I've been thinking that little song from Sesame Street's been going in my head, like one of these things is not like the other. I have no idea what you guys are talking about. Like, this is literally, it's a language and it's a concept that I truly have never really thought much about. Prior to being asked to come and speak here, I had never heard of a complete street. In fact, I thought a complete street just meant you had asphalt and you're good. I met Andrea earlier this year doing some advocacy work down in Miami-Dade, and we were looking for individuals to really get the community going around some advocacy issues, and she brought the idea of purpose-built communities to us. And at first I'm thinking this woman's talking to the wrong person, she should be talking to all of you. But by the end of the conversation, I realized there is a role for foundations, that this is not just a government issue, that this is an issue for the community to get behind as well. And as we're going to talk about with this panel, this is also a social justice issue. This is an issue about equity, about making sure that our communities are built with parity and that all individuals have safe places to walk, to ride bikes. And we're going to hear from 3 experts around the issue of equity and health and how we should be looking at our communities a little bit differently. So the 3 panelists we have today, first we have, who do we have? We have Gabriela Arismendi. Is that, oh, I practiced so hard. Gabriela is a transportation and mobility planner for the city of Westminster, Colorado. She coordinates planning and engineering efforts to increase equitable mobility and smart city transportation. Prior to Westminster, she worked for the Metro Plan Orlando, coordinating regional efforts on sustainable mobility and health planning, and addressed last mile connectivity throughout the Central Florida region. Again, I don't know what half of that means, but she's going to explain it to us. Then we have David. David Francis is the Community Government Relations Director for the Greater Southeast affiliate of the American Heart Association. Mr. Francis works with local governments across the Southeast affiliate to adopt policies that lower the cardiovascular disease and increase cardiovascular health. And then, finally, we have Ms. Tamika Butler, who is actually from my home city of Los Angeles, so welcome, Tamika. She serves as the executive director of the Los Angeles Neighborhood Land Trust, a nonprofit organization that addresses social and racial equity and wellness and by building parks and gardens in park-poor communities across greater Los Angeles. So with that being said, we're going to invite our panelists up. They're each going to do a presentation. Hopefully we'll have time at the end for questions and answers. And with that being said, Gabriela.
Sorry, technical difficulties, so we're going to jump to, there we go. Right. All right. right, hello, good afternoon, everybody. Thank you so much for sticking up all the way until the end. So my name is Gabby Arismendi, or Gabriela. I am the Transportation and Mobility Planner, and today I'm going to talk to you about multi-generational approach to complete streets and why does it matter. So first of all, let's start off, clicker, there we go, perfect. So first of all, let's go by the generations, and let's try to make, since it's the afternoon, let's try to make this a little more interactive. Silence, where are my silents? If you're a silent, please stand up. They can, hey, oh, come on now. No, yes they can, come on. All right, how about my boomers? Where are my boomers? Come on, I know you're out there. There you go, come on, yeah. All right, my Generation X, those 90210 fans. Oh, look at that, woohoo! Right. All right, my millennials, come on now. Woo! Yeah. And interestingly enough, I know we have our Generation Cs right over here. I see some young folks, which I love to have this. They are right here. They are I'm sorry to tell the millennials, but we're getting old now because the Cs are taking over. All right, so why all the focus on the boomers and the millennials? It's pretty darn simple because we have the numbers. Boomers are 87 million strong. Millennials are 93 million strong. And so it's a generation that, it's a number that obviously affects how we build our communities, how we build our streets, right? Now, on top of that, Florida has a lovely cherry on top that is, aside from their population, the boomers make about 27% of the Florida population. Then we're talking about millennials are about a quarter. But the cherry on top is my minority population. My Latinos, my blacks, my Asians, and all the other different races that are part of Florida itself. Now by 2040, Florida will be a minority-majority state. What that basically means is that minorities will make up more than 50% of the population out there. And so you all have to plan for all three core groups, right? You have to plan for the boomers, you have to plan for the millennials, and you have to plan for the minorities. And while a lot of people out there feel that what each group wants is extremely different, I'm here to tell you that that is not the case. Our trends and tendencies are actually meet very well when it comes to our urban environment. Millennials, of course, it's all about walkability, it's all about sharing economy. We love our kale, we love our rainbow chard, and so therefore, we're a little bit more healthier. Our senior citizens, the majority of them, we're talking about the silents and the boomers, the majority of them, first of all, for those who said, oh, they cannot walk, or they cannot stand up. Actually, silents are far more, they're far more fit than the boomers. Boomers actually have a more obesity crisis that is happening to them right now. So it's quite interesting how how we tend to think about different elements, right? But seniors in general, when you're about to retire, the majority of you guys want to age in place. However, 47% of you guys have said out there to ARP that you want mixed-use communities where you'll be able to walk to restaurants, to the park in a safe and convenient manner. Latinos, we're a multi-generational household, and also the rest of the minorities as well. My mom is going to come live with me as soon as she decides to retire and stop being a workaholic. That's not a question in our minds whatsoever. But unfortunately, we have Latinos in particular, we have unintentional injuries as one of our issues that actually, health issues that get us killed every year. Unintentional injuries by CDC standards actually also incorporate roadway deaths. So this is actually something that is happening to us as a particular segment. Now, because we're not that different, to us, complete streets equals health, right? Because all we need in order to reduce our BMI is just 20 minutes of a brisk walk. 20 minutes, that's it. And we know that when you have transit accessibility, the average transit user walks 20 extra blocks per month. That's 240 per year. So just by walking to transit, you're more than likely meeting that 20-minute standard. Now, neighborhoods that have sidewalks, 47% of their neighborhood, of those residents actually walk more. Now, the sad part of it about it is that 70% for Black communities and 81% for Hispanic communities, we lack the recreational facilities. And sidewalks in Black neighborhoods are 30 times likely to have worse conditions, cracked sidewalks or no sidewalks at all. And people like me, a Latina, I am more than likely gonna get hit by a car when I walk down the street. And that's not just in Florida, that's also in Colorado. People yield less to me according to how I am dressed because I don't look the certain way. So, when I was back in Metroplan, Metroplan Orlando is the Orlando MPO. At Metroplan Orlando, we conducted the first transportation health impact assessment of Florida. And it was a 22-mile corridor, and the question at hand was whether we should invest in bus rapid transit along Colonial Drive. The segment itself was 230,000 people, that it was divided in 5 different segments. Pine Hills, Downtown, Azalea Park, Union Park, UCF, and Oviedo. Now, my minority communities were Pine Hills, Azalea Park, and Union Park. My wealthy communities, Downtown and Oviedo, and of course my millennial community was over at UCF. Now, can you guys guess which segments had my lowest average median income? Pine Hills and Azalea Park. Which ones were my wealthy, communities? Downtown and Oviedo. Which ones were the ones with the highest levels of obesity, diabetes, asthma? There you go, thank you, yes. Pine Hills, Union Park, and Azalea Park. So this is data backing up that minority communities, minority neighborhoods are having the worst time when it comes to creating a healthy environment and that our land use impacts. Now, I took a look at the bicycle and pedestrian fatalities. So between 2009 and 2014, the 22-mile corridor saw 509 bicycle and pedestrian crashes, 509. Out of those, 32 fatalities were pedestrians and 6 were bicyclists. Keep in mind, I don't know where Jim went, but from Seattle. Seattle just talked about last year having 11. So just you remember the numbers that, before we were thrown out here of, where these large metropolitan areas are at and how they're reducing Vision Zero is actually working. This one corridor had 3 times the amount of bicycle and pedestrian fatalities that a city at the scale of Seattle is having. Come on, that's just not right. And where do these accidents were occurring? My minority, segments. Azalea Park, Union Park, and over in my UCF area. So, as being a good plangineer, we throw out, okay, let's try to spruce it up. Let's try to actually talk about how engineers and how the other folks were. Let's monetize this because this is costing us money, right? So one of the lovely tools that USDOT, the U.S. Department of Transportation, has given us is the value of a statistical life. And that basically it's putting a value on what does it cost to not just respond to the accident at hand, but what that person or that would have contributed to the society itself as a whole, right? And USDOT gives you a formula for discounting according to the injury level that you have. So $9.4 million. And please feel free, start monetizing what those accidents are actually costing your community. So if we put it up against the 509 accidents that has happened in the corridor, it was $1.1 billion in cost-effective safety improvements that could have been implemented, that could have saved lives. Now, let's assume that, okay, for whatever reason, we just want to save a third of them. Let's try to figure out, okay, if we implement it today and we just want to see a success rate of 30%, that would have been 87 million of cost-effective safety improvements. So by not building complete streets and complete streets in every neighborhood, not just the fancy downtowns, it's costing us money as a whole because we're all paying for this. And the issue here in Florida is that for 4 years in a row, for 4 years we have been at the top 10 of dangerous by the signs. And so we need to start as an entire state to change, to start addressing that and saying, yes, unfortunately that is the reality, but you know what, we're gonna do something about it. We're gonna change the picture, we're gonna change the dialogue because we want to address this because this is costing us money. And it's costing us money for the minorities because this is targeting minorities and this is targeting senior citizens that are out there. The two of the three groups that you know that you have to, this is impacting the most, that you can do it. And so when you build streets where moms have to rush through the darn intersection, when there's no sidewalks in front of the transit stop, when we have block sizes that are 3 or 4 times larger than the standard block, and we blame the people for doing mid-block crossings, but you know, it's a humongous block, seriously. We complain that we cannot find a parking space in front of the mall, yet you're asking people to go out of their way to be able to cross safely, right? Or even when you're crossing safely, you only have 15 seconds to cross the darn 6-lane intersection. When parents don't feel that they can let their kids walk to school because they're afraid that they're gonna get hit, it's costing the state and it's costing your region. Now, how is it costing you on a more direct level? So yes, the South is always going to be a really good place for senior citizens to retire. Florida is always at the top of the list. But there's an actually interesting trend that is happening where seniors are choosing cities that have transportation options that have other different elements of quality of life. So, and there's a reason, for example, why the Villages is, it's a fantastic place, in general to retire, because once you get there, it feels safe for people to be there. Now, and I think most of you guys know, where are the millennials moving to? Take a wild guess. The same darn places, very similar places to where they're moving from. Transportation options, recreational facilities, safe environment. That's where we're moving to because for the millennials, it's about quality of life, right? Now, I am one of those millennials. I moved to the lovely where the big blue bear is at. And we moved over there with my husband for a variety of reasons. And I'm not here to tell you that Denver is a fantastic city that is all, heaven. It's not. We have a lot of different issues over there. We have a lot of gentrification, the gentrification discussion is happening. And unfortunately, the people that are moving from the East Coast and California to Denver, we're bringing our driving behavior over there. Yesterday, a girl got dragged for a mile while walking to school, and the driver did not notice, even though people were following him and honking at him. She got dragged for a mile as crossing going to school, and because he thought that he had just hit a cone. So what is happening all over? It's happening all over the place, and so. What we did over there, I'm going to go take it really quickly because the time is up. The Mobility Action Plan in Westminster, Colorado, where I worked. Every time there is a NIMBY that is out there that's saying, no, I don't want this in my backyard, what we usually go out and do and just make sure that we go to the areas where people are at. So with my Mobility Action Plan, we made it extremely easy for people to provide feedback. We camped out at the transit stations and at the grocery stores, at the minority grocery stores, and basically color-coded Post-its to just let us know what's the issue that you have. You can write it up or you can just plaster it in there. And the key thing to that is that because out of that effort, we had over 750 people telling us what did they wanted to see in their streets. And that is why we've been able to retrofit suburbia into something better than we are. And so that's my job on the other end. 750 is the most amount that the city of Westminster has received in less than 9 months because we went out there and then after we got the feedback, all feedback was equal. It doesn't matter if you can go to a city hall meeting or you can just put a Post-it with like, I almost got hit here. That's it. All feedback is equal. So it was a successful effort, and I'm hoping that we start seeing all of those elements. Make me want to come back, people. That's all I got to say. So that is it. Thank you.
Good afternoon, everyone. If you don't know, today is National Wear Red Day. For those who are wearing red, thank you very much. We appreciate it. As I said in my intro, my bio, I am the Community Advocacy Director for the American Heart Association. I work with local governments, and we try to implement policy that will make everyone be able to live a healthy and happy life. Our mission at the Heart Association is very simple: build healthier lives free of cardiovascular disease and stroke. Through that mission, we created our 2020 impact goal, and to reduce the death of all Americans through cardiovascular disease by 20% and improve the health of all cardiovascular Americans with cardiovascular by 20%. So you wonder why we do Complete Streets. Well, we all want and deserve to live in communities that are safe and healthy to be active in. And Complete Streets lay the groundwork to make livable communities by ensuring that all people can get to where they need to go safely and to get to where they need to be to use the resources that are available to them. Creating the foundation for a culture of health in your community, Complete Streets take that and put down the foundation so you can make sure that, that everyone has the resources they need. This is a good infographic. It was done by the Robert Woods Johnson Foundation, and the Robert Woods Johnson Foundation wanted to create this infographic so we can make sure that we understand the difference between equality and equity. If we look at the infographic, equality, giving everyone the same exact thing, is not going to work for everyone. Each city and each municipality that we work in has a very unique characteristics, and within those characteristics, we need to make sure that we are providing the equity that they need to make sure that they can succeed and to be healthy. Sorry, I lost my place here. So I want to talk about some of the social determinants of health. I'm here today because I have good education, I have a good job, I have a good means of transportation, and because of that, I have a good access to healthy foods and access to quality health care. Far too many families that we see in our cities and neighborhoods aren't so fortunate. Complete Streets, implementing Complete Street policies can give them a huge step moving forward in facing the problems that they're having. Historically, communities of color and low-income communities, the deck is stacked against them. That's why the AHA focuses on social determinants of health. We know that zip code matters, and social determinants of health are those factors where you were born, where you grow, where you live, where you work, and where you age. So we really want to know, we really understand that zip code matters, and we know that income is tied directly to your health outcomes. Oh, sorry, I missed that one. Social determinants of health, zip code. So we know that restaurants and convenience stores in low-income communities are more prevalent in selling unhealthy foods to their families. We know that education is tied directly to your health outcomes. We know AHA did a scientific study that said that education is the most prevalent factor when determining your health incomes. And we know that when we see communities of blight and communities that have depressed property values, that implementing Complete Street policies can go a long way into turning and transforming those into desirable places for families to move in and live. There was a study done by Smart Growth America, and it showed that Complete Streets attract local businesses, attract private investments, and can increase property values. So how does that translate? So that kind of gives you a good understanding of why the American Heart Association is looking into Complete Streets. So what are we doing now? Where are we? Where are we running our campaigns? And I want to highlight a couple of places that we've been working on. Right now we have a campaign up in Jacksonville, and we're working with the city directly to determine how they can update their mobility plan to include our health equity language. We're doing it directly with the city. We've thought about forming a coalition, but the city has been very open and honest, so we are working with them and their work group to update their 2030 mobility plan to include the health equity language. Now I want to move over to New Orleans because we took a very different strategy there. Instead of the traditional strategy of forming a coalition, putting polite pressure onto the local elected officials, they created what they called their ambassador program. Through that program, they asked high-level volunteers to join the campaign, dedicate 3 hours per week for 3 months to be the eyes, ears, and mouth of the campaign throughout the entire project. We were partnering there with a group called Bike Easy. Bike Easy received a grant from the Robert Wood Johnson's Foundation to do the ambassador program to provide a stipend if it could help people come on board. Also through that grant, the Bike Easy created a report, and I want to make sure I get this right because it was very, very interesting. The report established an approach to evaluate complete street programs' performance without large-scale data collections. The report identified populations facing greatest health and safety risks and how a complete street could benefit those most vulnerable as identified by the report. And the report was created so any city can replicate what they did to determine what those factors are in their own community. The report was released just in December of 2017, and they're using that report to influence the local elected officials to take the next steps to adopt a complete street campaign. So we have successfully completed some campaigns here in the South. The Greater Southeast Affiliate, which is my territory, is Tennessee, Louisiana, Alabama, Mississippi, Georgia, and Florida. One of our first successes was Nashville, Tennessee. When we first heard about, the mayor ran on a campaign of inclusion and safety for the city of Nashville. And when she got into office in September of 2015, she looked at updating their comprehensive plan to include some health equity language. AHA went into strategic campaign mode. We reached out to people to form a coalition. We did education to our volunteers. We started putting polite pressure on our local elected officials. But through that, we also used our board members and high-level volunteers to talk directly to the city officials. And through those talks, we were able to get them pretty much to agree to everything we wanted. Now, from November of 2015 to May of 2016, several meetings and several drafts later, through the Nashville Next Comprehensive Plan, we were able to get them to include some health and equity language into their plans. So moving forward, they would all get, every neighborhood and every project would be prioritized equally. Before I get here, I wanted to go back real quick. I want to also say that some of the lessons learned from that campaign, there are best practices and universal language around complete streets that are known to all of us here in this room. But what we have to realize is that when we go in and try to adopt policy, as an advocate, you have to make sure that you understand the unique characteristics of each community that you're working in. And you need to be able to tailor your strategy and tactics to meet the needs of that community. It's not a one-size-fits-all. And some of the other successes we had, just real quick, Charlotte, I'm just going to go with Charlotte and then I'm going to move on. But Charlotte was passed in 2009. So as everyone says, be patient, it takes time to do this. But since 2009, they've had 12.4 miles of road conversions, 40 miles of signed bike routes, 40 miles of greenways and off-street paths, and 80+ sidewalk improvements since they passed it. That's a huge number. So even if you pass policy now, be patient, it will get there. So where do we go from here? This is the American Heart Association and the Robert Woods Johnson Foundation created Voices for Healthy Kids. It's a collaboration between both our organizations, and we give out grants and we have resources for people who want to mobilize the communities to affect change. They give out grants for biking and pedestrian funding, complete streets, and safe routes to schools. Whoop, it didn't show up. Why didn't it show up? Okay. It's supposed to be their logo up there. I apologize. But you can go up and visit their website at www.voicesforhealthykids.org. You can look at the grant opportunities that are available to you, and you can look at, they have good toolkits and media resources that you can download directly from the website. I'm also going to plug the American Heart Association You're the Cure network. That's our network that allows you to sign up and be involved and advocate for things the American Heart Association is working on both locally and at the state level. So one of the things the American Heart Association does, I'll be real quick, one of the association does is they ask their employees to show you, tell you what their why is. They ask all the employees, what is your why? Why do you do what you do? And, you know, when I first saw this, I got a little cheesy, but I get it. You know, it's okay, I get it. I see where you're going with this. Well, at first when they asked me, I said, well, my dad is going to be my why. He had a heart attack at 38 years old. He suffered sudden cardiac arrest. He survived, and he's doing well today. But last year, and unfortunately the picture didn't show up, I don't know why, but my stepson is Zach Glover. He was walking to a park that's about a mile away from our home. He was born 1 pound, 1 ounce at 23 weeks old. He's developmentally disabled. And my wife and I were trying to teach him to be more independent so he could live on his own with limited supervision. As he was walking to the park that's about a mile away, he was waiting at a crosswalk, signal turn, he started walking, he was struck by a car. Went up about 10 feet in the air, landed directly on his head, suffered a basal fracture in his back of his skull, and he suffered a subdural hematoma on his left side of his brain. Fortunately, physically, he is now okay. Mentally, we are working through it. It's a long process. But his personality has changed completely. But that also renewed my passion for what I do, for my work. Zach is now my why. It is important that we understand that we have an opportunity today to move forward and adopt policy to make streets safe for everyone, not only to be healthy, but to be mobile and to be active, and give everyone the opportunity to live a healthy and active life. Thank you very much.
Thanks so much for sharing that personal story with us. It's hard to follow that. It's the end of the day, and I'm the last speaker. And usually speakers apologize for, you know, what they're standing between you and, but you guys are standing between me and cheese. And so I'll try to make this as quick as possible. But I want to make sure that everybody does a quick little energizer. So if everyone could stand up. Everyone stand up, turn to someone next to you, look them in the eye, say, we're almost there, and give them a high five. Give them a high five. Okay, so my name is Tamika Butler. I'm the executive director of an organization called the Los Angeles Neighborhood Land Trust. I used to be an executive director of an organization called the Los Angeles County Bicycle Coalition. The reason that I say complete neighborhoods is because oftentimes, especially when you're talking about equity, you know, folks say low-income folks of color, they don't care about these things. They have other things going on. They don't care about a bike lane. And I remember when I first took my job at the Bike Coalition, because my background is a civil rights lawyer, all of my friends were like, what are you doing? This is gonna ruin your street cred. Bike lanes are the first sign of gentrification. You used to be down, you're a sellout. And the thing is, in low-income communities of color, it's not that we don't care about bike lanes, it's just that no one's cared about us. And so you're coming in and you're laying down some paint for a bike lane, but our trash isn't getting picked up on time. The buses are never on time to our neighborhoods, or we don't even get service in our neighborhoods. There's no fresh food. There's no access to a grocery store. And so when folks come in and say, let's have a conference about complete streets, I always say, I usually cuss, but I was told not to cuss. I usually say, we don't give a care about a complete street if we don't have a complete neighborhood, because all of these things matter. And so a little bit about who I am. It looks like all of our slides got a little wonky, but a little bit about who I am. I list my Twitter handle there. The name of my organization is in the corner. Even though I'm here really just to talk about transportation, you're gonna see some stats on park, because in order for my board to let me travel across the country, I have to talk about parks. So feel free to tweet, wow, Tamika talks a lot about parks. I'm not gonna talk that much about parks. So who am I? I was young and restless at a time, and so folks who know me well know that I'm a huge Kanye West fan, Kanye pre-Kim Kardashian. I'm a huge Kanye West fan, and Kanye is from Chicago, and he has the song where he says, do you know what the Midwest is? Young and restless. And so I'm originally from the Midwest. I'm originally from Omaha, Nebraska, and I was very young and restless. I remember looking around and thinking, I'm too black, I'm too gay, I can't live in Nebraska. And so I applied for law school. I applied to like 50 law schools, because when you're very black and very gay, a lot of law schools give you free applications. And so I applied to law schools all across the country, and right before I was supposed to go visit the very prestigious schools along the East Coast that some of our previous speakers are affiliated with, I went to California in the middle of a Nebraska winter, and that was it. I went to law school at Stanford because sun. And after I graduated from law school, I practiced law for a few years. As I said, I was a civil rights attorney at a legal aid office. And in my time there, I realized what many lawyers realize: it's horrible. And so I became a recovering attorney, but when you go straight through from undergrad to law school, you don't have many marketable skills, so you can do policy work. And so I worked at this organization called Young Invincibles, and it was a nonprofit of millennials. The oldest person at our organization when I worked there was 34 years old, and she reported to me, and we were focusing on issues that were impacting millennials. And the most pressing one was the Affordable Care Act. And so we were talking a lot about public health. And a lot of people like to give millennials a hard time. Oh, we can't multitask. Oh, we take everything for granted. Oh, if you're my dad, you don't know how to walk up the hill both ways to go to school. I don't really understand it. But what we always talked about is my generation is going to be the first generation that's worse off than our parents' generation. And we're worse off because of the investments that are being made or not made for my generation. And that is particularly true and salient for low-income folks and folks of color who are millennials. I say I was young and crazy because after I did that job, I started riding a bike. I had a friend, the same friend who introduced me to my wife, said, you should ride a bike, when I told her that the doctor said I was fat and needed to work out. She said, you should ride a bike. And the doctor was looking out for me because she knows that young millennials, again, we're going to be worse off than our parents. I was at risk for diabetes. So my friend convinced me to buy a bike with little tires. And in my head, I'm like, only white people do this. But not ride bikes because, black folks of color, we've been riding bikes for years. I always tell people we invented bike share. Like, homie, let me borrow your bike for a minute. I'll bring it right back. So it's not that we don't ride bikes. It's the little tires that really get us and the spandex. But she told me I should get a bike, and I ended up riding my bike from San Francisco to Los Angeles. And my mom said I was young and crazy. She's like, you moved to California, you eat salad, you talk about all these, environmental things, and now you ride bikes for a job? We paid for law school, and I have to remind her, you didn't pay for anything. I'm still paying for it. And so The organization I'm at right now is an organization. We are a developer. We develop parks and gardens in low-income communities of color. We also organize the communities. We make sure that the community has a voice in how it is done. And so, again, I've been in transportation planning spaces. I've been in all types of land use transportation spaces. We are not an organization who shows up at a meeting with little dots and says, put it where you like. We show up for meetings with blank sheets of paper, and we say, what do you want to see in your community? And before we even get to that point, we knock on every door in a community where we're considering building a park or garden, and we say, do you want one? If people say, no, we need affordable housing, then we go back to whoever owns the land, and we say, you should build affordable housing. Here's our partner who does that. If they say, we don't want a park because it's going to increase truancy and drug use, that's a public education moment. And then we start having meetings about how green spaces are part and parcel to safe and comfortable communities and complete streets, and how it can totally start to change the landscape of the community on public health, on transportation, on many benefits. And our opening speaker today talked a little bit about that. And so my job is really cool. I get to make a lot of kids happy. It's not that hard. You pull out big scissors and everyone's having a good time. This is me with our general manager of our Department of Recreation and Parks and the city council member in South Central Los Angeles. And so I'm funny and I'm enjoyable and I have really great dimples, but sometimes people are like, so wait, why are you talking about transportation? What does transportation have to do with anything? And people start looking around and scratching their heads, and they're like, oh my gosh, is it time for the drinks yet? Why is Kim with Kanye? Who knows? But before I really get into the work, I like to talk about words that are important. So a lot of us have started talking about equity. It's gotten sexy. It's gotten popular. We've even hired a person of color in our organization to be that person and to do that work. I always like to push back and say, let's not talk about equity. Let's talk about inequity. That's what it actually is. Don't come to my community in South Central Los Angeles and tell me you're there to talk about justice, because the only thing I've seen in my community is injustice. So when we're being honest about what we're doing, we have to use the right words. And you saw the Robert Wood Johnson Foundation bike picture. The most popular picture that a lot of people put out there when they talk about equity is the picture of people looking over the fence at a ballpark. And one of them's really short and one of them's really tall, but if you give them all the same box, the short person still can't see over the fence. And so equity in its most simplistic form means the people in the communities that have historically gotten the least amount of resources get the most. That's really hard for people. That's particularly hard for decision makers because it's their job to advocate for their community. So they don't want to be the one at a city council meeting. In LA, we have 15 city council members. And you don't want one of them, they don't want to be the guy who's up there, and I say the guy because we only have 2 women. They don't want to be the guy up there that's like, well, I represent the West Side where there's a lot of rich, wealthy white folks, and our streets are fine. We have bike lanes, so give them to South LA, give them to East LA, because they don't want to have to go back to their constituents and say, I didn't fight for you. But the reality is that once you move into a position of power, you have to acknowledge the historical inequities that plague low-income communities of color. You have to acknowledge that those communities need more because we have had policies and practices and procedures to keep them as the other, to keep them segregated. There is a reason there is a term, the other side of the tracks, because that's where white people wanted us, on the other side of the tracks. And so when you're doing this planning and you're supposed to be representing everyone, you have to realize that for so long, there are communities that haven't been represented and they need more. And eventually, we need to get to the point where there's not even the fence, where there should be no barriers between people and the things they want to experience and enjoy in their community. And the only way we'll get there is if the people who have had less because of policies based in historical racism and white supremacy are acknowledged, are talked about, and are fought against. This idea that a rising tide raises all ships is BS. And it's BS because some people have yachts. Not me. Jay-Z and Beyonce, they have a yacht. And if I'm in my little rowboat with holes in it trying to keep up to the yacht so that I can get to the party with Blue Ivy, I'm not ever gonna do it when the tide rises. They're not even gonna notice the tide is rising. They're not even gonna notice me. Meanwhile, I'm still just trying to get water out of the boat. And so saying a rising tide raises all ships ignores the historical way that our country has treated low-income people and people of color. I also think people like to talk about diversity. And when people talk about diversity, they like to often use like really fun clip art pictures where there's like the ambiguously ethnic person and the person in the wheelchair and like someone who looks older and someone who looks really young. And so that's what diversity means. And for me, you have to go beyond diversity. I am impatient with diversity. I am no longer interested in serving on someone's diversity committee because the reality is you want diversity to get diverse voices at the table. But if you have those diverse voices and faces at the table and you never allow those people to engage in the decision making, then your process and your table isn't inclusive. A diverse table doesn't matter if it's not an inclusive table. Are we letting the folks who are often not at the table have a voice once they get to the table? Are we just inviting one so we can check a box and tokenize them? And when we look around at our meetings and we say we can't get them to the table, they just don't care. Is that really about them, or is it about the fact that they already have tables and we're too uncomfortable to go to their tables? And so maybe the answer is going there and not asking them to come to us. The next, thank you. It's hard, right? Because we got to rush. I only have 5 minutes. I'm going to go a little over. So the next thing is racism. And for me, this is the hardest one, especially with the current political climate in our country. No one wants to be called a racist. And because no one wants to be called a racist, we never talk about it. And so we talk about things like, oh man, this community doesn't have a sidewalk, or oh man, people of color are less likely to, have drivers yield for them. And oh man, I don't know why this happens to this community because of racism. And if we can't say it, and if we're afraid of saying it, then nothing's ever gonna change. You can't fix a problem that you can't even name. So you have to name it. And it's not a bad thing to name it. And just because sometimes there are things that happen that are racist, sometimes because we have planning that is racist, it doesn't mean the people who are doing it are racist. And because we're so afraid to be called racist, we won't say it. We won't acknowledge when we've done it. And the story I always tell here is when I first moved to LA from San Francisco, and I moved to LA for a girl, thank God she married me in the end. And, there's not a lot of benefits always in life to being gay. But one of them is when you move to a new city, you can just say to the person you're dating, I need a gynecologist. Can you tell me who your doctor is? And so I did that. I asked my wife, or my girlfriend at the time, who's your gynecologist? She's like, oh my God, you're gonna love her. She's amazing. She's the best doctor I've ever been to. She's in Pasadena, which is a wealthy white neighborhood. She has like this old house that she's turned into a clinic. It's amazing. So I go to the gynecologist, I take off my clothes, I lay down and do what we women do as we wait, and in walks this black woman. And I was mortified. I do not like black gynecologists. I do not want a woman who looks like my mother asking me why I'm there to see her today. It doesn't work for me. And so I somehow struggled through the appointment, and then I got home and I was so mad at my girlfriend, and I said to her, why didn't you tell me she was black? And she looked at me and she said, why did you assume she wasn't? And so for me, again, I'm not a racist, but sometimes, because I live in a society that is racist, and because I've been conditioned to believe that people that look like me can't be doctors and can't be the people leading at the front of the room or who walk in and help fix all of your ailments, because I've been raised in a racist society, I had a thought that was racist. And that doesn't make me a bad person. If we can't, and especially the white folks in this room, if you can't get comfortable with saying racism, then I don't want you planning my city. Because if you can't get comfortable with that, you're not gonna do a good job for people who look like me. And you may say, oh, there's not people who look like you in my city, but I guarantee we work at your restaurants. We take care of your kids, we take care of your lawns. We're okay to do that, but we're not okay to plan for? You have to ask yourself why, and you have to think about the intersections of where all of these things come together. And because so many of us in this room understand how traffic works, we know intersections are messy. They're not clean, a lot happens, you try to organize them, and they still kind of get a little crazy, especially at certain times of the day. And that's what intersectionality is. You have to think about all these different layers when you're doing your planning work. And you have to think about oppression. You have to think about the ways in which both overt oppression, which is really the type of thing that feels heavy that we all know is happening, even as the targets we know it's happening to us, and you have to think about covert oppression, the type of oppression that all of us women understand when we're in a room and we're in a meeting and we say something and no one responds, and then Bob says it and everyone's like, Bob, that's a great idea. Let's follow up on that. And we go home and we say, oh, I wasn't articulate enough. Maybe I didn't say it clearly. That's not true. There are systems in place that are covert that keep certain people down. And they happen in the way we plan our streets, and they happen in the meetings where we're planning those streets. And if we can't talk about that, we shouldn't ever get to the stats. The what's actually happening in our streets and in our communities and in our complete neighborhoods. I don't really like stats as much as other people because I don't think you have to think just about what, I think you have to think about why. When you look at stats of Native American communities that have higher rates of alcoholism, when you look at African American communities that have higher rates of obesity, those are stats. But the why of the stats is because stuff kind of sucks. If you were living in a country and then people came there and told you couldn't speak your language, you had to cut your hair, they were going to isolate you to a certain part of the place that you technically own and tell you you can only be there, and then years later they'll name all their cities after you, they'll pronounce them horribly, but they'll still tell you that you aren't worthy. When you are in a country minding your own business and people come over with the ship and take you, make you work for free, and then the second you say, I don't want to work for free, you're now lazy. If all of those things happen to you, you might eat more, you might drink more, you might smoke a little something more. Maybe not here in Florida, but in California it's legal now, so it's kind of crazy. But all of these things are the why. My time is up, I've been told, so I just want to end with when you're doing this work and when you're centering equity, you have to think about outreach. You have to think about doing it early. You have to think about engaging community-based organizations as partners. You have to make sure that your community has access, and not just being able to get there and having food and being accessible to transportation and having childcare, but is it language accessible? Are you actually speaking in the language people understand, whether or not that's a foreign language or in terms they understand? And if you are translating, is it only the people who don't speak English who have to feel like the other by having some sort of machinery in their ear, or does everyone go through that experience so that you're all in community together? And when you do this engagement, you have to think about who you're doing. The only two things I want to talk about on this slide is you can't go into people's community and start from saying their culture is inappropriate or they're doing something wrong. The food pyramid, when people came around and said you should eat these food groups, and then you come to some of our communities, we don't have those foods. We don't have access to those foods, or just in our culture, we don't eat them. So you're telling me there's no way I can be healthy? You've lost me from jump. And the reason I like to talk about using local leadership and co-powering is because empowerment is a term based in white supremacy. It's a term about having power and bestowing it upon other people. It's colonial. It's not what's really true. The power is already in the communities. The knowledge is already in the communities. So if you want to transform communities, you have to co-power the people who are there. In LA, in East LA, there was an intersection that was horrible. People kept dying. The Department of Transportation came in with their fancy engineers, with their fancy degrees, and they put in a crosswalk. And then you know what happened? People kept dying. And so they went back and they said, what's going on? And they finally started to talk to some people. And what they realized is, because in communities of color, no one cares about us, despite how hot it is in LA, there was a bus stop across the street with no seating and no sunshade. And so grandmothers would come across the street where there was a huge tree, and they would sit under that tree. And when they would see the bus coming, they would run across the street as fast as they can. It just wasn't fast enough. And so even when they put in the crosswalk at the corner, no one was using it because they would still have missed the bus. You could have saved a lot of money, but instead, they didn't talk to anybody. They didn't trust that the power was already in the community. The last thing I'll say, because I know my time is up, is that I think when we do this work, if we really, truly care about it, because everybody says they care about it. Remember, nobody wants to be called a racist, so they say they care about these sorts of things. But if we really care about it, my mom taught me when I was a kid, I was on the early end of millennials, how to balance a checkbook. And she told me when she taught me how to balance a checkbook that when I'm budgeting for a month, I have to think about my priorities. Do I want to go out, or do I want to have food on the table? And in the way we do our work, in the way we plan our cities, we have to budget for our priorities. So yeah, doing this work takes longer, but if we really care about equity, if we really care about the most vulnerable people, if we really care about reversing the impacts of historical racism, we have to put our money where our mouth is. We have to invest in it. And the last thing we have to do is prioritize it. I am very confident. I'm one of the best speakers you had today. You put me at the end. You put me at the end of an agenda when we're out of time, where I'm gonna run out of time. If you value these things, how do you prioritize them? How do you make sure that they are integrated in every thread of the day, all day, and that the people who are gonna unapologetically talk about who they are and where they're from, and the fact that white supremacy makes every single day unsafe for them in public space? If you're gonna leave that till the end of the day, then what's your true investment in this work? And so my thought is, next year when you're in Miami, and you're thinking about how to pull this together, and you're thinking about really making sure that you can impact lives, if you make things better for low-income folks of color, they will be better for the folks who traditionally show up at your meetings. And so how will you prioritize and how will you pay to make sure that those of us who have so long been forgotten are actually part of the conversation in a way that feels real and authentic, and like it matters to you just as much as it matters to me. Thank you.
One quick question.
Amazing. All three of you guys, amazing. And Tamika, you said you weren't sure if you could follow, and I think you followed. So thank you very much. So I was told we have time for one question, and I'm going to actually take the time to make a statement instead of do a question. All right, that's my, I get to do that, right? So at the very beginning, when I introduced myself, I said that some of the organizers had the foresight to invite me, and as I'm sitting here and I'm listening to the conversations, I'm now realizing they're so much smarter than I even realized, because social justice is what Allegheny Franciscan Ministries is all about, and I knew I would come here and learn about stop signs, and I learned today about the medians had the plastic on it or the rubber medians. And so I learned a lot of cool things, but I did not know I would end the day hearing about equity and oppression and hearing about quotes from Martin Luther King and how all of this is connected to the social justice issues in our community. And that really is what this is about. At Allegheny, we're doing some work in Overtown, which is a small little neighborhood in Miami. And I was really happy to hear Tamika talk about really bringing this down to simple neighborhoods. You know, Miami's doing amazing things. Some of the most innovative, fun communities happening in Wynwood and other communities. And literally a mile away, there are streets that have been torn up for years, and businesses have just been decimated in black communities. And I think it's really important that we don't just look at the city level, because every single one of you city representatives in here are doing amazing jobs, but even within your cities, there are communities that are being neglected. And so how do we find those corners of our communities and advocate on behalf of those communities? And there's one thing I want to just share is that I truly am a reformed person today. And when I drive very fast. I'm one of those jerks on 95. And last night I learned that there were about 40,000 deaths, traffic deaths a year. And I went to dinner with some friends up here because I used to live up here, and I shared that statistic, and they said, "That's it?" And when they said that's it, I thought the same thing. Just 40,000? And then I realized we live in South Florida, where every single day when you're on 95, you see an accident. And every single day there is traffic after traffic because of the way people commute and the lack of respect. And I learned today that we're in the top 10 of communities in the country that are designed poorly, and that's why these things are happening. And so I leave here today truly reformed. I swear I'm going to slow down. Who knew that I would advocate for smaller lanes, for 20-mile-per-hour speed limits? Are you kidding me? I am a reformed person, and my hope next year is that you guys invite me back in Miami, in my community, my new community, and that I'm able to participate what we are able to do as Allegheny Franciscan Ministries, a tiny little foundation that doesn't have the money that your jurisdictions have, but we have a role in it. There are things that I heard today that we would fund and that we would help that march. And so my plea to all of you out there is, you gotta take this conversation out of just your communities. This is not just the government situation. And you need more people like me in this room shaking their head and understanding what you mean by complete streets. So thank you for having me, and I'm so happy to be here. Thank you. Thank you, guys.
Wow. Tamika, you know, I'm going to have to disagree with you. I don't think I would have had it any other way than you to close this summit. Let's give her another hand in this panel. Great job. Wow.